Do you have pain just below your kneecap? If so, then this video is for you, so stay tuned. There are 3 key signs that indicate whether the exercises that I'll show you today will help. First one, your pain worsens after prolonged sitting, squatting, or climbing stairs. You feel more discomfort during deep squats compared to shallow ones. You frequently sit with your knees bent beyond 90 degrees for more than 30 minutes. If these sound familiar, you're likely dealing with patellar tendonitis or patellar tendinopathy, also known as jumper's knee. This condition involves wear and tear of the patellar tendon, which runs from your kneecap, patella, down to your shin bone. That degeneration can lead to chronic pain, inflammation over the tendon, and limited function if not addressed early. Today, I'll show you 3 of the most effective exercises that I recommend to my patients, ones that have constantly helped people get better. But first, please hit the subscribe button and give this video a like if you find it helpful. It really supports the channel and helps me to keep producing content for you. The most important step in treating patellar tendonitis is not strengthening nor stretching. It is reducing inflammation. That starts with resting from aggravating activities. But I know avoiding squats isn't easy, especially when they are part of your daily routine. But here's what you can do. Try not to let your knees move too far forward when squatting. Why? When your knees go excessively past your toes, your quadriceps, the front thigh muscles, lose their mechanical efficiency for muscle activation. That creates more strain directly on patellar tendon. Also avoid deep quadriceps stretches that overly bend the knee. While helpful for some, these stretches can place unnecessary tension on the irritated tendon. If you must stretch, stay within a comfortable range, but note this isn't a primary treatment strategy. The first one is active knee extension. This exercise is not about building strength over quadriceps. It is to improve knee straightening range of motion. When you happen to lose your ability to maintain your knee straightening motion during standing, that constantly puts tension over the tendon. So here's what you should do. Sit on a chair and kick your leg forward all the way up to straight motion with foot maintaining in neutral or bring towards you. You should feel stretching over the backside of your knee. Hold for 5 seconds and repeat 20 repetitions. Repeating the exercise will help to maintain full knee extension while standing. The second exercise is clamshell. Gluteus medius and minimus muscles are very important to align your legs straight, especially for anyone having knee moving inward or positioning knock knee during squatting. Lying down on your side and bend your knee and maintain your foot, hip, and shoulder joints, making straight line, and bring your knees up towards ceiling. You should not compensate by bringing your pelvis backward. When you feel your muscle activation over the side of your glutes, that's exactly the right muscles. Repeat 20 repetitions on each side. Last one is hip mobility exercise. This exercise is to retrain your squat pattern. Remember, every joint has its own purpose of function. When you're squatting down, your hip is the one should be primarily moving while your knee joints function as stability. Start shifting your hip joint backward without your knees moving forward. Your upper body will automatically want to bend forward, so squeezing your core muscles will help to avoid the motion. Continue squatting down as your hip shifts backwards, and once your hip joint is located at the same alignment to your knee joint, that is when your knees can go slightly forward, but just slightly forward. Knee moving forward during deep squats will only happen with slight range with focusing on hip hinging. When you do them right, your knee joint would not feel much pressure. You should feel more of hip mobility. Try 20 repetitions until your hip joint goes down to the same level as your knee joint. Once this becomes easy or pain-free, you can try going down all the way like deep squats. Just remember, pain relief from rest or anti-inflammatories doesn't mean you're cured. Unless your movement patterns change, the problem will likely return. Fixing the root cause is what brings lasting results. If this video helped you, please give it a thumbs up or subscribe for more. Drop your questions in the comments or email me directly if you like more personalized help. Thanks for watching, and remember, movement done right is the best medicine. Thank you. Bye-bye.